Hi, this video is the art of hair transplant restoration surgery on an African American man who has a receding hairline corner, and he wanted to recreate his hairline as perfectly as he can, and especially with the corner as well. And his tempo has gone back. So on average for the African American men and Asian men, from the mid eyebrow to the hairline is around 6.5 to 7 centimeter. This client is roughly around almost 7 centimeter. And then from the tempo, the midpoint to the sides, average from 7 to 9 centimeter, and his is around 7.5 centimeter. As you can see, the angle of the tempo, for Caucasian, most acute backward, Asians less, and black men is really perpendicular. For other ethnic, the tempo is important, but not as important as for black. Why? Because the tempo for black is really frame the face much better, and so we have to make it more perpendicular. Because if I lower his hairline only and without bringing his tempo, he has some hair, but then his forehead is wide, and so you want to make it really nice and straight down. So this is his shape. You see, straight perpendicular. We'll go straight across, and straight perpendicular, and we'll curve up. Something like this is around 1,500 to 2,000 grafts. Just depend how much density we want and how low the hairline we want to get. And once we get the shape down, because when I do the surgery, I'm very precise. We measure from the mid eyebrow up and from the midpoint to the side, and then we zigzag. For black men, they like the zigzag to be smaller. Why? Because they line up the hairline anyway. So if you do a big zigzag, then the hairline will be higher when you line up with the clipper. For other Asian, Caucasian men, they have bigger zigzag. And then the angle, the hair, as you can see, when you cut the hair real short, the most black hair really hug in the skin. So that's why the angle of the exit out the frontal is down around 15 degree or up to 20. But for Asian and Caucasian, instead of 15, it's actually higher, 35, 45. And then we change, we go different direction. For the tempo, it's really flat against the skin and pointed backward. So not only the precise angle is important, the selection of hair grafts is important. And we transplant rows and rows of single hair graft in the front, followed by regular 2 hair, 3 hair, 4 hair, and back for bulk and volume. As you know, I'm one of the very few surgeons who specialize in the art of restoring black hairline, whether for men and for women. And why the hair, black African hair is so difficult is because it's not only the hair is curly, but the root is curly as well. So it's very important to have a lot of experience in working on black curly hair, because if the clinical surgeon not experienced, they will destroy most of the graft doing the harvesting part, doing the dissection part, and doing the placement of the hair graft part. And if they destroy most of the graft, the result won't be good. And on top of it, most of the clinic, if they're not experienced on creating a black man hairline, they'll probably give you a white Caucasian man hairline, or the hairline that doesn't look match, or the hairline is all the way up here. But that's, and that's not natural. So this is the art of hair transplant on a black African American man, and I'm very excited for him because his look gonna completely change next year. After he has his hair, he can line up his hairstyle any way he wants. Now, hair transplant is not a perfect science. Sometimes you're gonna need more than one surgery to have perfect density. Sometimes you can get away with one, and so it just depends on each individual. And the more hair you put in, the less chance you have to come back. Thank you.